Welcome once again to Health Times, and joining me today is Kai Chikanda from the Ministry of Health and Childcare. Kai, you're a nutrition officer, right?
Nutrition manager.
Good. But so today we're talking about food safety and some of the interventions that the Ministry of Health is actually implementing to ensure that the foods that children consume are not just tasty, but they are also healthy and they have some nutritional contribution that they are actually providing for the children. So Kai, could you just take us through some of the things that you guys are doing as the Ministry of Health at the moment to actually protect children from consuming foods that might harm them in the long run?
Okay, thank you so much, Michael. So we have policies that we have in place. The recently gazetted public health regulations on infant and young child nutrition, SI 192 of 2024. These stipulate the types of foods that can be marketed and sold for children feeding purposes.
Okay.
So this is from birth up to the time they actually reach up to even 6 years, and even up to school going. This is also part of the larger Public Health Act that looks at issues of food labeling, to say what's contained in this food. Things that have high fat, high sugar, high salt should not be marketed for that age group. So this helps to say that whoever does anything against this law will be penalized. If anyone, be it a manufacturing company of these foods, if they market aggressively in a way that makes parents or caregivers, get waylaid to want to buy and give those foods to their children, they can be liable for what? For prosecution and those things. So this is what we are doing to try and help. And also the issues of food labeling. We have it in our plans as we review our Food and Food Standards Act, to become the Food Safety Act, to actually say how should food be labeled. Would want simpler ways. People cannot understand when you say carbohydrates, fats, whatnot, but if it's green, maybe to say this is good food, you can go for it.
Yeah.
If it has amber or yellow, say proceed with caution, minimize this. And then if it has red, they know it has high fat, high sugar, high salt content, and would be minimized. So this is some of the things that we have in the pipeline and some of the laws we already have in place, that we want to update, to make sure people who are now using social media and the other various medias to advertise and market their food, which is not very healthy, will also be limited. Thank you.
But Kai, you find that our kids do love these snacks, those that come with high salt and sugar, whatever contents. How healthy are these foods that our children are exposed to?
So most of the foods that have high fat, high sugar, high salt, there's issues of overweight and obesity, where children are now becoming very fat. And for girls, it puts them at risk of, early puberty and risk of teenage pregnancies. And then in terms of NCDs, the non-communicable diseases, you have issues of cancer, diabetes, and even hypertension can also happen. If you think that hypertension is only for the elderly, it can also happen in children
Is
and
it?
young people. Yes. So these increase, they decrease quality of life, and high risk of disability. If hypertension is high, risk of a person getting a stroke is also very high. So imagine having to spend the rest of your life on a wheelchair, the disability adjusted life years, poor quality of life, and increase the healthcare costs in something that can easily be preventable.
Oh, thank you so much for your time, Kai. It's been a pleasure.
Likewise. Thank you, Michael.
Thanks.